today I'm going to talk about the dental care in Sweden and the education for dentists that we have in Sweden. So it's just a short overview. And I'm going to talk a little bit about what the situation looks like in Sweden if people are going to the dentist regularly or not, and what the caries situation looks like. But at first I'm going to do some short data on Sweden. We have a population of 10.1 million, and if you compare with Ukraine, the area of Ukraine is 1.3 times bigger than Sweden. So, and the population in Ukraine is about 4.5 times larger. So I think you have almost 45 million people here in Ukraine. The population per square kilometer, 3.3 times more people per square kilometer here in Ukraine. So we have a large country and very big areas where people don't really live. So dentists, we have about 1,300 patients per dentist, and in Ukraine I understand that you have about 1,700 patients per dentist, so it's quite similar. We have some laws in Sweden regulating the dental care, and what the law says, the main goal for the dental care is to prevent diseases. So we're working a lot with prevention, and we can see the effects of that. Also, we have a demand of high technical and hygienic standard from the government. It should be accessible, so even if you live in rural areas, you still have the right to go to a dentist. So and that's the government that sees through, looks through that we have dentists in all areas. Now we are getting more and more problems with mountain areas and inland, that we don't have as many dentists as we would like to have. Also, the law says that it should be evidence-based, and we have been working a lot with the national guidelines for the National Board of Health and Welfare, and I think we have around 3 years' work. I hear that you have something similar to that, but we listed all. This was the government that decided that we should spend a lot of time with all the specialists that we have in Sweden to list all kinds of problems that you can have in the oral cavity, and then they were listed, and then we were also listing what type of treatment can you give, both the good treatment and the bad treatment, and then we ranked the treatment out from all the published papers, scientific papers that you had on different treatments. So we recommend some of the treatments and don't recommend. So it's not like, it's a little bit like this, but this is from veterinary students that you have broken leg, shoot, infected eye, shoot. But it's not like that in dentistry. You have different types of treatment that you can have. So we have the national guidelines, and people are dentists are they have to follow them. So if you don't follow the guidelines and something happens, then you will have a problem. So the dental care in Sweden, we have about 25,000 persons working within dental care, and it's dental assistants and dentists and dental hygienists. And we have around 8,000 dentists, and 60% of them are working in the public dental care that the government owns, and about 40% is working in the private dental care. Today, about 56% of the dentists that we have are women, and when we look at the dental students that we get today, we have around 75% are women of dental students. And we have had an unchanged ratio between patients and dentists the last 15 years, but we have a big lack of dentists now, so we have more, we have a big demand for more dentists. Then we have the dental hygienists, and I'm going to show later that they have a 3-year university education, and they are doing some of the work that the dentists were doing originally. So they're in the public dental care, the dental hygienists are doing about half of the examinations of patients, the basic examinations of the patients. And also in some clinics, the dental hygienists are making dental restorations. So they are doing the dentist's work for half of the salary. And the public dental care likes that. So we have about 4,300 dental hygienists in Sweden, and they are increasing fast because they can help a lot with the examinations. So and the number is increasing. It's about the same here, that 60% are working in the public dental care. They are doing a lot of examinations on children, for example. So you can go to the dental care for several years without meeting a dentist. You meet a dental hygienist instead. So, but it works. The providers of dental care in Sweden, we have the public dental care, and then we have to take care of the dental care for children. So we have an obligation to the government to take care of the dental care for children. So we are doing that mainly within the public dental care. And a lot of the specialist dental care is also within the public dental care. We have also private dentists who are specialists, but the main part is in the public dental care. We have also dental care for patients with special needs, that they're sick in some way, or handicapped, or something like that. Those patients usually go to the public dental care, they don't go to the private dental care. And also we have the general dental care for adults, but the main part is children within the public dental care. The private dental care, there we have a little bit less dentists, and usually it's general dental care for both adults, and now they can also treat children. It's a difference from the last 5 years. Earlier, the private dental care was not allowed to treat children, but now it's up to the patients if they want the child to go to the private dental care or public dental care. So, yeah.
Did you name that the dental care for children and adolescents is free as charge?
Yeah, it's coming later.
Yeah, it's coming later.
So we have also specialist dental care within the private sector. What about the dental care habits in Sweden? We have freedom to choose where we want to go to, if we want to go to the private dental care or the public dental care. Och And the dentists are free to choose their prices, so they can set the level of the price of a restoration, for example. So it's up to the dentist. For many years, between 1974 and 1999, then the government set the prices. So usually when they looked at how much do we need to get the same income as last year, then usually the government decided that half of that. So it was a big reduction. I think it's a 50% reduction of the income for dentists during these years. And then when they let it free in 1999, then it went up, but now it's stabilized. So it's quite affordable for most of the people. We have the government set reference prices because we have an insurance where the government pays for a part of the dental care, and then they cannot pay whatever to a dentist. They have to have reference prices. So and there they have checked everything from what it costs, how many minutes a dentist is in the room for making a certain restoration, how much costs for. I calculated on all the materials that we are using in Sweden, so how much they needed. So if you want to know how much a filling weighs, or a root canal filling weighs, then I know. Around 85% of the healthcare costs, healthcare, that's general health, is paid by the government. And for the dental care, they pay about 43% of the dental care costs. And we have a national insurance scheme where you have subsidies for dental care and high-cost protection. So if you get very expensive dental care, then the insurance system will take care of that. And then we also have the county councils where the children's dental care is taken care of, and hospital dental care, elderly dental care. So we have dental hygienists going out to homes for elderly to check the oral situation for the people who live there. But the patients are paying most of the part, 57%. We have free dental care for children and youth up to 23 years of age, so they don't pay anything. Patients with special needs, with somatic and psychiatric disabilities, they get a free preventive dental care for 2 times a year for €30 that you can reduce your cost. So it's for preventive dental care for certain diseases and handicaps. For the adults, we have the national insurance scheme where everyone gets a voucher from the government in 2 levels. If you're between 24 and 29 years old and above 64, then you get €60 per year, and an examination with removal of calculus and x-rays, it's like €85, so it's almost free. It's not really free, but it's almost free, very, very low cost. And for people between 30 and 64 years of age, they get €30 per year. So usually people go to the dentist every 2nd year, and if they don't have any problems, then they pay €12 per year for the dental care. So it's quite cheap. Then we also have a high cost protection scheme, and that's if you have up to 300 euros, you pay everything yourself beside these dental care vouchers that you get. So, but if you get above 300 euros, up to 1,500 euros, and that I would say it's like 2 crowns, then you're up to 1,500 euros. Then you're only paying 50% of that cost, and when you get above 1,500 euros, then the insurance pays 85%. So it's so the cost levels out. So it's even though you need a lot of expensive dental care, so you don't hit the patient as badly as if we have a good insurance system. And as I said, we have free pricing. So, but the compensation that the patient gets is from based on the reference prices. So, but usually people are dentists are close to the reference prices. It's not. If you go to the center of Stockholm, for example, then you will pay much more. But on the other hand, they can have like 700 patients per year, and they have to survive on those. So they get a lot more dental treatment than you're getting up in Umeo, for example, where you have perhaps 1,300 patients per dentist. So some of the time it's not always necessary dental care. What about the situation is people going to the dental care? About 2/3 of the adults are visiting dental care for a regular basic examination within a 3-year period. So most of the people are going to regular examinations. So they get a call from the dental clinic. Now it's time to visit. And about 85% of the adult population access dentistry in a 2-year period, not regularly, but they are there at least once during a 2-year period. For example, in France, they have no basic dental care. They only go to the dentist when they have problems or pain or something. So we have another type of system. And if we look at the part of the adult population that has only visited the dental care for acute treatment during a 3-year period, it was only 7%. So we see them quite often at the dental school. We have a department for acute dental treatment, and we are seeing them there, the people who don't go to dentists regularly. Also, we have a big discussion in Sweden on antibiotics, and we have been better and better not to prescribe antibiotics if it's not needed. So it's about 2% of the population that gets antibiotic treatment for dental problems during a 2-year period. Over 98% of the children aged 3 to 19 have been to the dental clinic for an annual checkup in a 2-year period. So most of the children are going to and the frequency of checkups is related to the individual risk factors. So some of the patients are coming every half year, and some of the patients are coming every 2nd year, depending on the risk. Patients that's 70 to 79 years old, they are visiting the dentist the most frequently, the most frequently visited age group in Sweden is 70 to 79%. They're going to 85% of them are going to the dentist. And the ones that visit the dentist the least is the young people. So about 65% of them are visiting the dentist during 2015 to 16, and that's because that most of them have not experienced caries, so they don't go so often. Something that has changed a lot since I became dentist. It's not because of me, but we have very few people with full dentures in Sweden today. In the age group 80 to 89 years old, 60% had at least 20 of their own teeth left. So we have a lot of old people with many teeth, and as I'm going to tell later, it's becoming a problem, because when you stop being able to brush your teeth, then the problem starts. The percentage of children and adolescents with dental caries that has experienced dental caries sometimes, and you see the 3-year-olds, it's only 5% who has had caries. The 6-year-olds, it's 27% that has experienced caries. 12-year-olds, 33%, and 19-year-olds, there you have 60% of them has had a cavity sometimes. So, and this is why the young people don't go so often to dentists. Many of them have not experienced caries at all. So here we have a big table with percentage of how many who has no own teeth. In the age group 60 to 69, it's only 1% who has no own teeth, and it's increasing. But it's only 6%, 6 to 7 to 8% of the 90-year-olds who have no own teeth. And as I told you earlier, we have for the 80-year-olds, it's about 60% who has 20 or more of their own teeth, and it's going to become a problem. Yeah?
By saying own teeth, do you mean whole tooth or a root and the crown on the top?
Root and crown is estimated as their own teeth. So no false teeth. If we look at what happened during the last we have a new dental insurance program in Sweden from 2009, so we have only statistics about what people are doing in the dental care from 2009. But now everything that a dentist does on a patient is registered. So now we have exact statistics on how many dentures we are doing in Sweden, how many restorations, if there are one surface restorations or two surface restorations. So we have statistics from 2009, and you can see that we had a little bit more than 3,000 new fillings made in 2009, and now we are down to 2.7 million. So it's 3.3 million in the start 2009, and now we are down to 2.7 million. So that's the number of fillings. But as you can see, that the large fillings with more than 3 surfaces, they are virtually unchanged. So it's the restorations that you exchange every year they say we spend about 60% of the dentist's time with an instrument in his or her hand is remaking old restorations. So, and the main problem is secondary caries. We are good at restoring teeth, but not so good at treating caries. So the caries is still there. So we remove all the infected dentin, for example, but we are not so good at making the patients taking better care of their teeth. And you can see that the crowns and pontics, they are about the same. It has not changed. So we have young people have fewer and fewer new restorations. Many of them don't have restorations at all. We have a very diversified caries situation. The immigrants and immigrant children, they have a lot of dental caries. They have the large part of the dental caries in Sweden. So it's quite it's not evenly distributed. We have groups with a lot of caries where they don't have a clue of why you're getting caries. If it's a deficit, if you should take a vitamin to avoid caries, or they don't have a clue. So that's why we have a problem in that group. And usually the first thing that you start to treat yourself with when you get a better economic situation is sweets, something that's sweet. It's all parts of the world. It's the same. What type of work do they do at the dental laboratories? It says a little bit about what we are doing in prosthodontics. We have about a fourth of what they are doing in the dental technicians' offices is fixed prosthodontics. That's the prosthodontics that you cement on your teeth. About 20% is done with CAD/CAM, and there we have a very fast change towards digital dentistry. So in our part of the country, all the public dental care offices have their own intraoral scanners. So we scan almost everything. When we even bite splints, when you have problems with the jaws, we scan that also. So we are, and it's when you have started to do it, it's okay. Dental implants, the large implant cases with edentulous jaws where you don't have any teeth at all, they are fixed already. So now it's getting more and more of single implants. If you, for example, if you knock out a tooth and then you have two undamaged teeth adjacent to the gap, then it's usually an implant that we are making if the other teeth are not harmed. We have a part of it is orthodontics also, and removable prosthodontics, but the removable prosthodontics is decreasing. The full dentures are going down, but partial dentures are on about the same level. So we are using that type of treatment. What we have for preventive strategies is to reduce attack factors from diet, frequency and amount of carbohydrates, and also tobacco habits. The dental care is, we are always asking the patients about tobacco habits. So it's part of the regular examination to ask about tobacco habits. And also we would like to improve the defense factors like oral hygiene, fluoride, and dental care habits. So that we have annual checkups and even even tighter checkups than that if we have patients with problems that need it. So, but as I said, yeah.
But tobacco factors are habit.
As I told you earlier, we have socio-economic factors that affect the oral health, and children of parents with low education, financial support from the government, and children to immigrants, they have a much higher risk of getting caries than other children. And you see it's the same, like surviving breast cancer has to do with how long you survive breast cancer has to do with the education level also. So if you have a good education, you have a much bigger chance to survive, and that's probably that you know that there are other treatments, that there are more expensive medicines that you can use that the people with low education don't know. So they get another treatment than the average patient. Yeah.
From your statistics, is it correct that what I understood, that 90 years old, still kids, young people, have caries in 60% cases? So 60% of 90 years old have caries.
No. The 19-year-olds, they have experienced caries in 60% of them have experienced caries sometimes. Yeah, so sometimes up to 19 years of age they have had caries. But we have a lot of 90-year-olds with their own teeth, and when they starts to get that they are dement, then when they have the problems with the memory loss, and then you have a problem with the dental care when they stop being able to brush their own teeth. Then you get a problem with those many teeth that they have. I have a patient now that I'm treating that is 84 years old, and she doesn't know that she's at the dentist's office when she comes to me. But we have very big problems because you can see that she has rests of food that's perhaps 2 weeks, 3 weeks. You cannot see what type of food it is, but she has 15 teeth with gold crowns, so she has a very expensive treatment, but now she cannot take care of it. And you have a problem with we should cut one of the bridges because you have a lot of caries in one of the teeth, but you can't even take x-rays because she doesn't understand what you're doing. She's so they still keep their teeth, but it's going to be a problem when they don't know how to brush them anymore, take care of them. So I think that we will continue to repair teeth, even though the young people have very little caries today. The old ones are getting it when they cannot take care of the teeth anymore. So it's a difficult situation. More and more people keep their teeth, their own teeth, but they are getting so old that they don't remember how to take care of them, and
but then,
yeah.
Does it solve the problem if they have artificial teeth instead of natural teeth?
No, it's if it would be removable, so you can remove it and brush it, then it would be easier. But when they have their own teeth, it's difficult because the personnel at the elderly homes, they don't like to brush teeth. They think it's much easier to keep the old ones clean in other places than the mouth. it's difficult to get a really good dental care in the elderly homes when they start to get problems with memory. So I don't know if it was the answer of your question, but so the public dental health in our part of the country, at 6 to 8 months, then the parent is getting a letter how to take care of the children's teeth. Brush the teeth if they are going to use toothpaste, and how much toothpaste, and things like that. And when they get 2 years old, then they have the first visit to the dental clinic, and usually we have days when we only have children, so they have fun activities at the dental clinics during these days, and then they get recommendations, different recommendations. We do a clinical examination if it's possible, because it's not always that they are opening their mouths when they are in this age. But they get different recommendations about fluoride and diet and oral hygiene. And then when from 3 years of age and up, then you have annual checkups with risk evaluation every time. So if nothing has happened since the last examination, then you get a little bit longer time until the next examination. So the intervals are changing. But we collect a lot of epidemiologic data during these years also, because everything is recorded. I told you about earlier with education level that it has to do with what type of treatment that you get. And here we have the share of persons between 35 to 74 years of age that has received at least one filling, root canal treatment, crown extraction, or have at least one dental implant during 2016. And when you look at fillings, it's no difference between the educational levels. It's the same. Root canal treatment, there's small differences, but you have a little bit higher risk if you have to have a root canal treatment if you have a low educational level. Crowns is about the same for every person. Extractions, you can see there we have a difference, that it's about twice as many that gets teeth extracted in if they have only elementary school. Dental implants, it's about the same. So it differs a little bit in some parts of our dental care. The statistics in Sweden are now so good, so we can see that, for example, we can pick out tooth 1-5 and see how many has got acute dental treatment for pain. We have that type of statistics. We can see that how many of those have been extracted, how many of those are treated with root canal fillings. We can see what they are doing on these teeth later. Are they only doing a composite resin filling, or are they doing a crown? And we can even combine systems, so we can use the tax system to see who are doing certain types of treatment. So we see that the people who have pain in a tooth that restores it with the root canal treatment and gets a crown of them, that's usually women with higher salaries. So you can combine different types of statistics to pick out who are getting treated and not. So it's possible. The challenges that we have in Sweden, as I said earlier, it's an aging population, and we have a problem to improve health among groups at risk. The immigrants, it's more difficult to improve the health in these groups. Lack of staff. We have today a lot of dental clinics with only part-time dentists. For example, in our parts of the country, we have if you get a job in the public dental care, then perhaps you have 3 weeks at the coast in Umeo, for example. That's quite attractive. But then you have to do a week in the mountain areas every month to get a dentist to these areas. So it's we have started to get a problem there that we didn't have earlier. And I say that it would be easy to fix, just raise the salaries. So it's getting more interesting to live in these areas. Then we have the lifestyle, the diet habits. The consumption of candies is quite high. Soft drinks, usually these energy drinks that people have all the time. We have a multi-ethnic population, and where we have problems with the attitudes, the prevention, they don't really understand why they are taking care of teeth. We also have the problem with diet habits, that we can see that they might give the children sweet drinks during the night when they wake up, and it's not so good. And also that we have problems with the attitudes towards an annual checkup, that they don't think it's necessary. The dental care in Sweden, if we look at customer satisfaction, it's the last picture. Then the customer satisfaction is very high for the dental care, a little bit higher for the public dental care than the private dental care. The lower line here is an average occupation, and the upper line is what people think about dental care. So that was a crash course on Swedish dentistry. So I think we take a pause here. And the next part is about dental education in Sweden and at Umeo University. Do you have any questions? You are free to stop me when my wife is always stopping me, but she's having a problem. But if you have questions, please.
Maybe me again.
Yeah, that's fine. Right.
I've heard that in Sweden kids are not given sweets during weekdays and only weekends.
Yeah, we are trying to do that, to instruct the parents not to give the children sweets during the weekends, only Saturdays. But it's working. Not always working, but
it's not a religion.
yeah, but earlier I think we were better at that they didn't get access to candy as much as today. But we're trying to give the children candy always, only during the weekend, and that they eat candy quick, so they don't eat it a piece every 30 minutes, so they have the problems with the acid attacks on the teeth all the time, so they are trying to eat it quick also. But we have been quite successful with dental care, but we have problem groups, so where they have a lot of carers today. Maxim?
Yeah, that's a question. Now you have shown that really in Sweden you have a low level of caries, dental problem, high amount of proper of own teeth in elderly population. So, but in Umea you told me that the previous situation was different.
Yeah.
How many years it takes to change situation? I think it was not very simple.
No, it was not. I would say that it started for real in the end of the 1950s, and then it's got better and better and up to the 1990s. But after the 1990s, it has not improved very much. It's about on the same level as before. So it took perhaps 30 years to improve the situation, and I think one of the parts for dental caries is the toothpaste with fluoride. That has been very successful, I think. And also earlier in school, when I was small, we had a dental assistant who came every week with, so we had to rinse, in school we had to rinse our teeth with fluoride for 5 minutes or so. She was coming into the classroom and with a tray like this and then we had to rinse the mouth for 5 minutes with fluoride. So,
how many times per day do you recommend to brush your teeth?
2 times.
But the question is that not after each meal, no.
No? Morning and evening, and many people are using liquids with that should reduce caries, for example, but they're using it after toothbrushing, and it contains a little bit of fluoride in it, and it contains alcohol and quite high percentage of alcohol. But what you're doing there is that you're diluting the concentration that you have on fluoride. You shouldn't use it after toothbrushing. You should do it between meals, but not after toothbrushing, because you're destroying a little bit of the effect of toothbrushing with fluoride.
May I ask question more specifically? In other countries, I've seen people try to brush their teeth after lunch.
Yeah.
Do you think it's a good idea?
It's a good idea if you need it. So if you have a problem, then it's a good idea. Otherwise, I think 2 times a day. So for example, for me, it would be a waste of time because I don't have any caries. So brushing more than that, it's not going to get any effect. Yeah.
And then 3 tubes, 2 times a day, 2 minutes with a 2 centimeter of toothpaste. That's the recommendation.
Yeah. The general recommendation is 2 times a day, 2 minutes, and 2 centimeters of toothpaste. But usually we say toothpaste as much as you can have on the little fingernail. So if it's children, then they should have less toothpaste.
Recommendation for adults.
Yeah.
What about chewing gum? Does it help?
Yeah.
Is it good for teeth?
If you don't have sugar in it, it's not bad for teeth, and you stimulate saliva and things like that, so it shouldn't be a problem. So do you think we should have a short break before the next part, or I think these ones are tired, so
Okay, let's take. Thomas has already left, so.
yeah.
5 minutes.
5 minutes. Yeah.
5 minutes.
Dental education in Sweden. Umeo on the map you can see in the upper part of Sweden, but it's not really, the red point is Ukraine. So we are not up in the far north, but we are in the northern part of Sweden, and we, for example, we have about 640 kilometers to Stockholm. So the large part of the Swedes are living in the southern part of Sweden, and we can see that on how many that applies to dental school. So we have fewer students that apply to the dentistry education in Umeo than in Stockholm or Gothenburg or Malmö, because we have the large part of the population there. So the placement of Umeo in Sweden is not entirely good when we look at the applicants, but we have a lot of, every year we have like 1,100 applicants for 72 places, so we have a good pressure on the ones that apply for the education. And Umeo is the largest city in the northern Sweden, so these are pictures from Umeo. We have 127 residents. We were the European Capital of Culture for 2014 with a lot of activities around that, both musically and theaters. And so we are a culture center with both an opera, theater groups and festivals. The city is very adapted to students, and that's why we have 260 kilometers of cycle paths. So the students are getting around with bicycles, and it's extremely well organized for bicycling, so you can get everywhere in the city. We have also a lot of exercising tracks around Umeo. Umeo University, we have 34,000 students today, and 10% are coming from abroad. We have around 4,300 teachers, and most of them are active researchers. And several of them are world-class distinction, and that's Thomas here. He's a world-class scientist. So we have at the university we have 153 different programs and 2,400 courses. So there are a lot of things that you can apply for. 37 master programs. And we have also more than 275 courses taught in English. But in the dental school we have no full courses in English. We have a lot of English-speaking teachers, so we have lectures in English, but not full courses in English. But we have a demand from the university and from the government that in 2020 we need to have at least one full course in English. So they are forcing us to an exchange, and they are working a lot now on that we should send students for exchange periods. And for the dental technicians it's easy because they have a 26-week laboratory practice, but the dental students, we have about a fourth of them that goes abroad during a part of their education. But the dental students are a little bit more afraid of going abroad, that they misses things. So if you're on an exchange during the 8th term and you are taught how to surgically remove a wisdom tooth at home, you cannot say it's okay that you have something else in the other country, that you have learned something about the culture in the country. You need to know how to remove a tooth surgically. So we have not that many. It's between 2 and 4 students that goes on exchange every year. So in the dentistry program, and we have also distance university, not in the dental school, but web university, and summer university. Many students are going to the summer university, that they take courses during the summer instead of working. So, and we have been ranked as a top ranking university for number 3 in Europe from on the International Students Barometer. So students from abroad likes to study in Umeo. We have the largest sports facility in the Nordic region, so that's where the students are going. Many of the students are going every day to the gym or some kind of training. So this is a facility for our students. So they have programs with different exercises, swimming. They take part in different groups, but we also have an 18-meter high climbing wall, for example, and they play volleyball inside even during the winter. So we have 23,000 visitors every week, and that's mainly students. And we have swimming pools, gyms, floorballs, indoor beach volleyball, so and group aerobics and weight training, climbing walls, and much more. So when the students have started to study in Umeo, if they only stay for the first 3 weeks, then they will probably stay during the full program. But if they are from Gothenburg and they find a place there, somebody who has not started to study or so, then they are likely to move south. But we have enough students. We have very good students. This is what the dental school looks like, and we have had this dental school since it was built in 1984. But the dentistry program is much older. It was the first program that we had before Umeo became a university. We had the dental school in Umeo, so we were the first education program in Umeo University. So we started in 1956. We have an education like yours that's 5 years, but we have no internship. We have they are doing all the training on patients in the school. They are not going out. They're working between the terms in the summer, but mainly they have the patients during in the clinic, in the student clinic. And we have 72 students per year, and we have 2 semesters per year, so a fall and a spring term. So, and all the clinical training is done at the student clinic, and we have no tuition fees, so if you're within EU, you will not be charged for your education, and it's the same as if students from Sweden go to Norway, they don't have to pay tuition fees, so it's quite nice. What does the studies look like? I think it's quite similar to you, to what you have. We have an introduction, we have a medical chemistry, cell biology, and that's where Thomas is taking care of the dental students in that course. He's responsible for that course. We have a course in morphology, physiology, pharmacology during the first year, and also microbiology, immunology, and virology. And then we have professional development. That is something about what the dentists do in their work. It starts during the first term, and I think it's the first 5 terms when they go out watching the work at the dental clinic or something like that. Different courses within this. And also we have tooth anatomy. These pictures from labs where they probably some caries lab. They're working in the pre-clinic also with plastic teeth and things like that. So during this first year. The second year they have the basic odontology training and pre-clinical training, and they have the course in oral and craniofacial biology. And my course is dental material science. It's the largest course except for the semi-scientific work that we have on 30 credits. So dental materials is 24 and caries I think is 19. So, but we have a lot of, it's not all about the dental materials, it's also a lot of preclinical training on phantoms during that year. They start to on term 4 they start to have patients in radiology, and they have courses in general and oral pathology, and also scientific method starts during the second year. That they are getting a part of science every year when they have to read scientific papers and put questions on that we tell them that they have to write at least 5 questions on a scientific paper that's relevant, and also to write answers. So it's that kind of training, but it's also about science. And this is what it looks like at my department, where they have the preclinical training. They are working on plastic teeth in dolls. We have also a simulation clinic now where they can, if they don't get patients during the hours during a part of the day, then the plan is that they can go to the simulation clinic and do the same work as they were planning to do on the patient. But we are not really there yet. We are working on it, but we are not really there yet. And this is also a picture from the preclinical training that they're showing what they have done, and you get an acceptance or not, and you get information and tips about what you should have done if it's not acceptable. So we have a lot of preclinical training. The third year, the clinical training really starts. But and this is the end of the dental materials science. So they start with clinical oral physiology. So it's like problems with the jaws, and they make bite splints and so on, but they don't drill in teeth of the patients. My YIDS course in endodontics starts during the third year, where they work on phantoms also. So they are not having the patients there, they are working on phantoms. But they start to work with cariology, with ordinary fillings, and what has happened during the last 10 years is that we are drilling much less today than earlier. We are more brave in putting shorter checkup times and leaving dental caries. So we don't drill everything that we see, and I think that's a good strategy, because when you have made your first restoration, it's the start of the death spiral for the tooth when you have made the first restoration. So it's you have to exchange it, and you get less and less tooth left. So it's the start of the death spiral. We also have the course in prosthetic dentistry, and that course is in the simulation clinic. So they're doing prosthodontics, but in simulation patients, but under clinical conditions that they have to work sterile, and that you cannot do what you do in a lab environment. We have to start in oral and maxillofacial surgery also, where they, for example, learn to use anesthetics. So we before they start to treat the patient. So that's in that course. But also we have a course in psychology, and that's a quite popular course because we meet a lot of different patients in our work. So, and also scientific methods continues, and the scientific project starts on the end of the sixth term. So they have 20 weeks to do a scientific project, and all the teachers have to supervise at least one scientific project. Usually we supervise much more. This is what it looks like on the dental clinic. We have half open rooms, so you can see if you need a teacher or a dental assistant, then it's easy to call them help. And this is a dental student and Majid's former boss there on the left. He's going to tell you tomorrow about always using rubber dam when you do root canal treatment, because it improves the prognosis of the treatment a lot. The fourth year, it's about the same subjects that comes in, but we have also orthodontics, and that comes in here. And also we have a comprehensive examination where we examine the students. So if they are not good enough clinically, then they have to start the sixth term again and go term 6 and 7 to have a chance to improve. So we had two times a comprehensive examination where you might be forced to go back in your education. And this is pictures from the student clinic, what it might look like. And the fifth year, here we have community dentistry, and we have pediatric dentistry. So that's what they are taught last, pediatric dentistry. And then we have an elective course that usually when students go abroad on an exchange, then we have this elective course when we can put the oral surgery part that they miss during the 8th term, so we can compensate for what they are missing there. And this is from the pediatric dental care. Usually they do very little restorations there. I saw some statistics that they are making 1 or 2 restorations during their studies to become a dentist, because we don't have children with caries in the center of Umeo. It's not more training than that, so but they get it when they come out. the preclinical and clinical training, I was talking about dental material science, so that's where the preclinical training starts. From terms 3 to 6, they have 400 hours of laboratory and preclinical training. And during term 6 and 7, the focus is on clinical practice, so they have around 16 to 24 hours clinical practice per week. So, at the end of the 7th semester, they have done around 1,000 hours of clinical practice. That's you will probably have that part on your internship when you are finished at school. But we had it like you earlier, but it stopped. And we are calculating that when the students leave school, they have around 2,000 hours of clinical training on patients, and that's quite a big difference from other parts of the country. They always say that we have the most clinical training in Umeo. In Malmö, for example, they have problem-based learning, and they have to find out everything themselves, so the students. So it takes time, and that leaves less time to practice on patients. So it's we have a lot of clinical training. This is what the cafeteria looks like for the students on the 9th floor. So they have a very nice view over the river and the town from there. I'm going to tell you a little bit about the 2 other programs that we have. The Dental Hygienist program, and that's they have today a 3-year education. Earlier, until the last year, they had a 2-year education, so you could go out and work with patients after 2 years, but now it's 3 years all over Sweden. They have 30 students per year, and very few of them are leaving. They're usually fixing their studies. We see something that's a little bit disturbing, both at the medical education and dental education, that we have more and more students that don't fix the studies in time, and they leave the studies. So we have a problem with from the government that we have to produce 72 dentists, new dentists every year, and we are not doing it. We are producing perhaps 60, and that's a problem. But we cannot say that it's okay if you remove the right tooth in half of the cases. You have to keep the standards. You cannot change them just because the students don't fix it. And I have had the chance of looking into the studies the last 6 years, and what I can see is that the students that we have today are not used to the large amount of studies that or reading that you have to do. They have good grades from school, but they are not used to the tempo studies that we have at the dental school. But the dental hygienists, they usually go through with almost 30 students per year, and after the 3rd year they get a bachelor in science of odontology with a major in oral health. The curriculum looks it's not very different from the dentistry courses, but they have much less. So they have a little bit of everything. You can see it on the subjects that they have, but it's much more limited, and that's why we think we are not really satisfied with that. They are doing dental restorations, for example. We have a 24 credit course in dental materials, but they might have 1 week, and that's not enough. That's enough perhaps to make to fill a hole with composite, but not much more. The second year, they have a lot of theory and practice in clinical subjects, and they have a 5-week practice out in the public dental care, and they have a minor scientific project during the second year. It's more like making plans for a study than they're not doing any actual study. They are making plans for a study. And here we get more and more clinical subjects, but still it's very little. So they have very little dental materials, for example. The dental assistants have extremely little of I had that course in dental materials, and that was a 4-hour crash course in dental materials. So all dental materials in 4 hours. So, but that was for dental nurses. And the third year, then they have oral health courses. They have dental care for patients in special needs, because the dental hygienists are the ones who are going out to visit patients in elderly homes and things like that. But also they have pedodontics, tobacco, drugs, eating disturbances. They have a lot on tobacco and drugs in their education, because they are the ones who meet the kids quite early. And then they have a scientific project on 15 credits. And they get a Bachelor of Science in Odontology when they have finished. I have been responsible for the dental materials for a long time, and also I have been responsible for the dental technology program for the last 20 years, I think, 21 years now. And it's a 3-year university education, and you get a Bachelor of Science in Odontology with a major in dental technology. And we have now one of the most modern dental technology educations in Europe since we changed the education in 2017. Earlier we had large spaces for old equipment, and we had a very extremely high rent. University raised the rent with ×3 during 1 year, and it became more and more difficult to pay for these large spaces. So we made a real change in 2017. So we moved out of campus, but we are still very close to campus. You can see it there, the upper picture. We have the dental technology education, and the first building in the back is the dental school. So it takes about 5 minutes, but we are situated in a real lab now. So we have real dental technicians who work in half of the space. So and they are sharing, for example, the cafeteria with the people who work at the real dental technician laboratory. So and they are very happy with the new education, and we have moved very much to digital production of crowns and bridges and dentures. So on the left bottom corner you see we have one room for ordinary dental technician work, and then the picture on the right, there we have one lab for the CAD/CAM, and we have 12 working workstations, and we don't have any lab in Sweden that has more workstations, complete workstations that we have than what we have in Umeo. So it's quite special. Nobody else has, in any private lab or any school, has more fully equipped CAD/CAM stations. And we were quite lucky because this equipment was much more expensive than we had expected. We had got prices that was much too low, so we were not able to get 12 working workstations. We were able to get 4 workstations, and we tried to get discount in both the Nordic region and Europe, but very small differences, so it didn't look like we planned. So then I found out what the owner of the company for the CAD/CAM equipment, what his name was, and I found him on LinkedIn. Have you been on LinkedIn? So I got contact with him there, and it ended with that we got this equipment for free from the company with free annual upgrades. So don't give up. Try to find another way of finding finances. So, but today we are filming a lot of things that we are doing, recording with the camera. So we have, you see here, we have just a small table camera, because we are working with, when your teachers are showing you how to prepare a tooth for a filling, then most of you are not seeing anything. You're sitting too far back. But if you have a camera real close and you can use the screen behind, then you can see very fine details. So, and also we are recording almost everything, so the students can go back and look at it many times, and that's they are very happy with that. So it gives a very good. That's the same here in the CAD/CAM lab that you see in the right corner down. That we have a teacher who is working with something, and then you have the students looking at the screen on what the teacher is doing. So it's and a lot of the work has gone to CAD/CAM, and that's what I'm going to talk about tomorrow. The methods that we have today. Some of them are working, some of them are not, but they are working on it. So thank you for your attention. This is a picture of the campus in the winter, and they have a balloon flying from the campus. So we have a lot of snow during the winter, and the last 2 winters have been terrible. So if you have 2 places where you have to remove the snow, then it's almost too much. Okay, do you have any questions about the Swedish education and the education in Umeo? Yeah.
You mentioned that from 72 applicants,
Yeah.
only 60 finish.
Yeah.
And why?
They are, some of them are leaving for that they have got a place in Gothenburg, for example. So they are starting the courses at the same time, and they are from Gothenburg. Usually more than half of the students are coming from the southern part of the country. So if they can move back, they are doing it. But if they have stayed for 3 weeks, then they will be likely to stay, because it's a very nice city for students. I mean, the mean age is 38 years, and that's because we have 127,000 people living there, and 23,000 are students. So But then we have the students who cannot manage to pass the tests, and they have to do it all over again. They get 5 chances of doing the tests. If they don't manage to do it in 5 attempts, then they have to stop the education.
How long? 5 attempts?
5 attempts, 3 during the first year with the ordinary course that they have done. One ordinary time for the test, and then 2 retests. And then they have to take the course again, and they do the test, the last 2 tests with the next course that comes after them. So they get 3 chances the same year, and if they don't fix it, then they have to come back. And we see a trend that for some of them it doesn't matter that much. They are not very unhappy about not passing. They are still studying, but the most popular, one of the most popular educations in Sweden is the education for physicians in Uppsala, and they are starting with 150 medical students to get 100 in the end after 5.5 years. So 50 are lost somewhere, and it's a problem because we don't get paid if they disappear. Then we lose 10,000 euros for each student every year that they don't use, that they don't pass the test. So it's a problem.
And 72 students.
Yeah.
From how many applicants? From 1100. 1100.
Yeah. So it's
about
a popular education, but it's even more popular in Stockholm, Gothenburg and Malmö. But I think we usually get the best results when they have checkups, when they have started to work as dentists. They think the dentist from Umeo has been most well trained clinically. So we have a good education, but we have a but we are in the north, but yeah, it's working, but it has become a problem. We have many times the university says that you have to increase the flow of students, but we can't, because we have to have the levels. It's not okay to remove the wrong tooth every second time. You have to. You cannot lower the limit for acceptance. You have to keep the level high because you have to treat the patient safely.
Okay. Андерс, or maybe some student need to ask in Ukrainian,
Yeah.
and I translate. Шановні студенти, задавайте питання українською, я буду перекладати. Професор приїхав за 2500 кілометрів, щоб нас зніматися. О, супер!
What about hostels?
What about?
Hostels. Okay.
About the hostel, about the accommodation, where does the student live?
Yeah, they live in student areas. We have quite nice student areas close to the university. So you have a good chance of you will always find somewhere to live in these student areas. But and they are building new apartments for students also. So that's usually they get a good place to live. I thought during my period as student it was the most fun period in my life when I was living in these student areas. A lot of partying.
Я жив в гуртожитках, з нашої точки зору їх гуртожитками не можна назвати. Ні, там дійсно класні, дуже класні гуртожитки, чи місця для проживання, але ви бачите, щоб стати студентом, треба бути дуже класним. Окей, будь ласка.
З України є студенти?
Окей.
З яких інших країн є студенти?
Okay. From which country you have the student? And the main question, is any student from Ukraine?
Not at the dental school, as far as I know. We have, because all the education is given in Swedish,
Okay.
so that's a requirement that you have to, but at the university we have the Ukrainian students, but not at the dental school.
Зрозуміло, да, що взагалі вся система освіти на шведській мові, тому на їхній програмі нема з України, але в університеті є, звичайно.
Можно вопрос, да? Вот дети, ну, как бы рассказывают то, что они болеют кариесом, а потом в один момент, как вот молодость, резко начинаются...
Нет, это имелось в виду. Okay, I will. I think it was the same question that Sergey asked. That why in 19 so many caries?
No. Yeah. Very good question, because I have got because it's these 19-year-olds. They have experienced caries at least once, but like my son, he had one small cavity in his primary teeth, but nothing in the permanent teeth, but he's still one of the 19-year-olds with caries.
Зрозуміло, принаймні один випадок мав вже на протязі, упродовж цих 19 років.
А, вони ще сказали, я з ними трішки говорив, що цікава інформація, що 85% оцих 19-річних, вони взагалі не мають ніяких карієсів.
Ще питання, будь ласка. Okay. Thank you very much for another question from me, from myself. So, dentist, as for me, it's more practical job compared to doctor, for example. So, if you compare lectures and practical classes, what rate are between?
I would say during the first years we have had a lot of courses together with the medical students, but usually the medical students, when they have had their lectures during the first half of the day, they can go home and study, but our students have to go to the clinic or the pre-clinic. So, but I would say that it must be more theory than clinic.
Okay, thank you.
So it's 2,000 hours of clinic, and you can calculate 5 years, 8 hours a day. But we have a lot of clinic in Umeo, and that's what we are known for. That we have a lot of clinical training.
Thank you very much for your lecture. I think everybody enjoyed it.